We're going to be starting with the definition of chronic homelessness. Then we're going to talk about eligibility, get into documentation requirements, and then we're going to wrap it up with some best practice tips and tricks for making sure all of the eligibility documentation is in place and accurate. And we'll start with the definition. So next slide, please. HUD issued a final rule laying out the definition of homelessness and the 4 categories in 2012. HUD later published a separate rule that addressed chronic homelessness and applies to all CoC funded projects. And recipients must comply with the rule for all program participants admitted after January 15th, 2016. PSH, so permanent supportive housing projects, can either dedicate beds to or prioritize serving clients experiencing chronic homelessness, and you'll want to check your specific grant agreement to confirm details regarding the number of dedicated or prioritized beds. Next slide, please. So who is chronically homeless? Someone who's chronically homeless is an individual experiencing homelessness with a disability who's living on the streets or in shelter. And this individual has been experiencing homelessness, and this can be a continuous 12 months, or it can be episodic, so long as they have experienced at least 4 separate occasions of homelessness in the last 3 years. And those occasions add up to a total of at least 12 months. You'll note that I said a person who lives in streets or shelter, and I'm using that as shorthand. And what I mean by that is someone who's staying either in a safe haven, an emergency shelter, or a place that's not meant for human habitation. So some places that are not meant for human habitation include a car, a park, an abandoned building, a train station, a bus station, an airport, a camping ground, or an encampment. Next slide, please. So as I mentioned, the length of homelessness, I skipped a slide. The McKinney-Vento Act, as amended by the Hearth Act, requires that the individual or head of household has a developmental disability that manifested by the age of 22 that results in a substantial functional limitation and impedes the ability to live independently and secure economic self-sufficiency. Or an individual who has HIV or AIDS, or a physical, mental, or emotional impairment that is expected to be chronic and last for an indefinite duration and impedes their ability to live independently. So this physical, mental, or emotional impairment must satisfy both of those conditions. And the physical, mental, and emotional impairment could be caused by alcohol and drug abuse, PTSD, or a brain injury. Next slide, please. So as I mentioned, the length of homelessness must be a cumulative 12 months at least. And again, this could be continuous or episodic. And again, with those episodes, that has to be 4 or more separate occasions in the last 3 years. And that should add up to a total of at least 12 months. And this second part that really speaks to the episodes, that's new per the final rule that was published in 2016. We're going to start with our first poll now, just for a quick comprehension check. Eli, okay, great.
I got it. Okay, so we are going to work through a hypothetical. We just gave you all of the basic information, like that is the full chronic homelessness definition. We're going to give each of those pieces to you. Again, there's going to be some repetition here because we know it's a lot and you're not going to get it from just hearing us say it once. But as we go, we want to start practicing this early, practicing applying. So we're going to look at the hypothetical of Kai. And Kai has been referred to your PSH project, and you're verifying that Kai is eligible as a person who is chronically homeless. So as a reminder of what Nicole just went over, there are 3 pieces to the definition of chronic homelessness. And I've just put them in the chat. You're looking for one, does the client have a qualifying disability? Two, what is the client's current living situation? Do they qualify because their current living situation is a place not meant for human habitation or an emergency shelter? And then three, what is the client's history of homelessness? Have they had a cumulative 12 months of homelessness or episodic 12 months of homelessness over four episodes over 3 years? So Kai is presented at your PSH project. 18 months ago, he left his dorm for safety reasons. And his friends Joe and Cam went with him out into the sort of unpopulated area around where they were living. And they have been camping there every night for 18 consecutive months. And they're still camping there. Kai suffers from nightmares, migraines, and acute physical pain. And our question is, based on this information, what is your best assessment of whether Kai is chronically homeless? And I'm going to throw up a poll. And your options for answers are yes, clearly chronically homeless, no, clearly not chronically homeless, uncertain, need more information. And I'm going to give us about, start with 30 seconds to get answers in there. And we're hoping for at least 50% of y'all to put in an answer. All right, let's see if we can get maybe 3 more people put in answers in there. We're just over 50% of folks weighing in. And remember, we're thinking, does Kai have a qualifying disability? What is their current homeless status? And what is their history of homelessness? All right, we're going to end the polling. And let's talk about this question. So seeing a range of answers here. The only response here that I think is not warranted by this information would be that no, Kai is not chronically homeless, because there's definitely a good chance that Kai is chronically homeless. And let's walk through those 3 pieces. So the most clear one, I think, is the current homeless status. Kai is currently sleeping in an unpopulated area, camping. And that is very clearly a place not meant for human habitation. Camping is an enjoyable leisure activity. It is not, under HUD's definition, a place for people to live as their permanent residence. So we have current homeless status, yes. We have, now we're looking for history of homelessness. Does Kai have 12 consecutive months of living in a place not meant for human habitation? Yes, based on this information, Kai has 18 consecutive months. So that clearly fits that second prong. And the last prong is where we get into the uncertain or need more information. We know Kai suffers from nightmares, migraines, acute physical pain. It seems like the way this is phrased, it seems like they're probably recurring, persistent. And that could indicate that Kai has a disabling condition that would fit HUD's definition. So yeah, great, we got this. So, but the disability piece is a little more, a little less clear, because we don't have a really clear checking of the qualifying disability boxes. As a disabling condition, Kai, this would need to be chronic and likely to be of long duration. So not a sort of short episode of these symptoms, and it would need to interfere with Kai's ability to live independently. It's very possible that these symptoms would, and that they would be of long duration, but we would really need to get Kai evaluated by a medical professional who's licensed to make those judgments to confirm those 2 pieces in terms of disability. But it seems very likely that Kai is experiencing chronic homelessness. So as a first run through, it's pretty quick, pretty straightforward. We'll come back to more hypotheticals, but I want to pause just briefly before we get back into the flow of things, see if there are any questions about that. And actually, if I could get everybody to give a 1 to 5, either on your camera or in the chat. 1 meaning I didn't understand any parts of that hypothetical. Can you repeat some stuff? And 5 meaning, yeah, that makes total sense. Give me a 1 to 5. How did that feel? Okay. Thanks for checking in the chat, seeing some 5s. Great. Excellent. Thanks to those of you who checked in. All right, I think we can go on to the next bit of presentation.
Thanks, Eli. So I've already mentioned a couple of times that one way to be categorized under the definition of chronic homelessness is if you've experienced 4 separate occasions. And we're now going to cover what constitutes a break and what does not constitute a break so that you're able to identify those episodes of homelessness. So a break in homelessness is any period of 7 or more, 7 plus consecutive nights in a non-qualifying location. And non-qualifying locations could be couch surfing, that could be a hotel paid by the individual, or it could be transitional housing. A stay in an institutional care facility does not constitute a break in homelessness if that stay was fewer than 90 days and the client was homeless and living in a place not meant for human habitation, so the streets or shelter, immediately prior. We do want to underscore that the language for category 1 literal homelessness for institutional stays is 90 days or fewer, but for the chronic homelessness definition, it's fewer than 90 days. So this means 89 days or fewer. So that's just an important clarification there. Next slide, please. An individual's stay in an institutional facility counts toward the 12-month total, so long as that stay is fewer than 90 days and they meet all of the necessary criteria before they've entered the facility. So an example of this is a head of a household with a qualifying disability had continuously resided in a place not meant for human habitation for 10 months. And now they've entered into an institution for 2 months. The 2 months count as time homeless, and the individual is now chronically homeless. Next slide, please. For chronically homeless families, a family can be considered chronically homeless if the adult head of household meets all of the criteria for chronic homelessness, and if there's no adult in the family, then a minor head of household must meet the definition of chronically homeless. Next slide, please. Chronically homeless families include families whose composition has fluctuated while the head of the household has been homeless. So, for example, if a person who qualifies as chronically homeless lost custody of their child at some point during the history of their homelessness, and during that time, the child was temporarily placed in foster care, the child may still be considered part of the family, and the entire family would qualify as chronically homeless, even though that child was housed for some portion of the 12 months of homelessness. We also want to note that the family can determine the head of household. So if there are multiple adults, the family can determine who the head of household is. And if there are multiple minors in the household without adults, they again can decide who the head of household is. In accordance to HUD's equal access rule, a family is any group of persons presenting for assistance together, and that's regardless of marital status, actual or perceived sexual orientation or gender identity, whether they have children or not, it's irrespective of age or relationship. And a child who's temporarily away from the home because of placement in foster care is still considered to be a member of the family. We do want to note that programs can limit to children with to households with children, however.
I want to put a finer point on that. So a program can say our our program will only serve households with children. We are specializing in that population with some eligibility criteria. The reverse is not allowed. You can't say we will only serve households without children. That is not permitted. I know that a lot of programs are set up primarily to serve adult-only households and may mostly get referrals of adult-only households because of unit size and the types of services that can be provided. But no program is allowed to deny enrollment to a household because there are children in the household. Just want to clarify.
Thanks, Eli. So putting it all together, this slide just provides a recap and some reminders. So chronically homeless means this is an individual or head of household experiencing homelessness with a disability. They've been living in a place not meant for human habitation, streets or shelter, and they've been homeless for at least 12 months, or that's either continuous or those 4 separate occasions in the last 3 years, if that's a combined total of at least 12 months. We want to remember that breaks in homelessness must be 7 or more nights, and institutional stays of under 90 days are counted as time homeless. So that does not constitute a break. So HUD heard about challenges communities were facing connecting their most vulnerable neighbors who either did not meet the definition of chronic homeless, or they might have met the definition, but it was difficult to obtain adequate third-party documentation. And in response, HUD announced in the 2017 NOFA dedicated plus permanent supportive housing as an option. And so with dedicated plus permanent supportive housing, these projects provide more flexibility with who they're able to serve, and it allows recipients to serve some households who are highly vulnerable but may not be currently experiencing chronic homelessness. So dedicated plus projects, along with serving individuals experiencing chronic homelessness, they can serve households who have resided in a place not meant for human habitation for at least 12 months in the last 3 years, but maybe they haven't done so on 4 separate occasions, which we know was a requirement under the chronically homeless definition. Dedicated plus projects may also serve people experiencing chronic homelessness who have moved into permanent supportive housing, but were not able to make that initial permanent housing situation work and then ended up back on the streets. Permanent house, dedicated, with this specific one about households who may have moved into permanent housing for whatever reason, weren't able to make it work and then ended up back on the streets, we want to note that this eligible category specifically refers to persons and households who were admitted for entry, enrolled in the permanent housing project, and exited that project all within the previous 12 months from the date of intake into the dedicated plus project. Dedicated plus projects may also serve a household that met the chronically homeless definition and is currently residing in transitional housing that's going to be eliminated through reallocation, or is residing in transitional housing that's funded through a joint transitional housing rapid rehousing component project, or it could it can serve households receiving assistance through the Department of Veteran Affairs and their funded homeless assistance program, so long as they meet one of those above criteria. We know those are complex options. They may be the first time you're hearing this. We've actually hyperlinked on this slide a checklist that goes through dedicated plus in more detail. And we just want to end this slide noting that dedicated plus definition applies to projects that specifically applied as dedicated plus projects. And whether your project is dedicated plus, or whether you're dedicated chronically homeless, and how many beds are chronically homeless dedicated are going to be in the project application that you applied for this grant under, and it should be under your project's eligibility record. So you're really going to want to check that. Next slide, please. So we're going to stop here if there are any just broader questions on this section before we move on.
I had a quick question. Can you mix up or have different parts, like for the chronically homeless, like let's say somebody else in the household has a disability, but the head of household does not have a disability, like make a combination to make them chronically homeless?
That's a great question, and not one I've heard before, and I love the creative, like the problem solving behind it. But unfortunately, the answer is no. The head of household needs to have all of the pieces of the chronic homeless definition to qualify. So you have to have at least one person who's the head of household who, in themselves, meets the definition of chronically homeless. But I really, really like the creativity of that question. Is that clarifying?
Yeah, that did. Thank you.
Okay. Any other questions? Okay, again, we are going through a lot of information, so we want to pause to apply it to help it sink into our brains better. Also, to say this again, we are going to be going through a lot of this information a second time when we talk about documentation. So we're really leaning on repetition because we know that there's a lot of details. But let's apply a little bit. So a little more of a complicated situation. And again, I'm going to put in the chat a reminder of the pieces that we're looking for. So for the primary 3 pieces of the definition of chronic homelessness, we're looking for a qualifying disabling condition. We're looking for current homeless status, and we're looking for history of homelessness. And as another reminder in the chat, a break in homelessness, if you're looking for 4 episodes over 3 years, how do you distinguish those episodes, right? There needs to be a break in between them. A break can be 7 or more days in a non-qualifying, sleeping on someone's sofa, staying, paying for a hotel room, something that is not streets or shelter, or 90 or more days in an institution. Either of those can constitute a break. So we're now trying to qualify Arami as eligible. Arami sleeps currently in a tent on the sidewalk where she has been staying for the past 10 months. Before that, so we have 10 months, before that, 14 days couch surfing with a friend after exiting a substance abuse treatment facility where she was staying for 12 and a half months. And before that, she lived in transitional housing for 6 months. Before living in transitional housing, Arami stayed in an emergency shelter for 1 month. And before staying in the shelter, Arami lived on a raft for 3 months. A lot of information, right? So what I would suggest, and the way that I would approach this, is make a timeline, right? This is not laid out perfectly in a timeline order already. So I'm going to give us maybe a minute, maybe 60 seconds to timeline this out. If you have a pencil and paper or a Word document or something, try to put this into a timeline and start looking for, does Arami meet the history of homelessness component? So I'm going to give us 60 seconds and I'll check back in. All right, now that we've had some time to think through the slightly more complicated history of homelessness that Arami presents with, I am going to throw up a poll. And I want to see so far right now, based on this information, have you been able to determine, is Arami chronically homeless? Does Arami fit our definition? And your answer options are yes, no, uncertain, need more information. I'm going to give a little bit of time to get some of those answers in there. For those of you who are still working through the timelining, I'll give you some time to do that too. Okay, we're at about 45% responded. Gonna wait for a few more. Take your time. All right, I'm gonna close it down in about 3, 2, 1. All right, so yeah, this one's a little tougher. We've got a little bit more variation in the answers here. So let's walk through the pieces. And I think the big piece here that we probably all spent the most time on is the 4 separate episodes, right? And we're going to 4 separate episodes because it was clear that Arami did not have 12 consecutive months in a qualifying location. So what we have is the first episode, chronologically, was an episode of 4 months, and it was actually 3 months spent on a raft and 1 month in an emergency shelter. And there was we weren't told about any break in between. So those 2 locations are 1 episode. And then there was a break of 9 months. So that break included 6 months in transitional housing, which is not a qualifying location. It included 2.5 months at a substance abuse treatment facility. And that is part of the break because the stay was long, because that is part of the break because even though it was less than 90 days, the location that Arami was in before Arami entered the facility was transitional housing. So in order for that institutional stay to be an episode of homelessness, Arami would have needed to be in streets or shelter before entering in the institution. And then 14 days couch surfing with a friend. And unfortunately, HUD does not consider couch surfing to be a qualifying location for chronic homeless status. So we have 1 episode and 1 break. Then we have our second episode, 10 months sleeping in a tent on a sidewalk. So putting this all together, there are not 3 or 4 separate episodes of homelessness, right? There's really only 2 based on this analysis. Does anybody disagree with that? Did anybody see something different? This can get, and we're gonna have a couple, go ahead.
I just wanted to add, I mean, aren't we also missing the disability piece, regardless of the episode?
Absolutely, yes, yeah. We just don't have enough information there. Really, really good catch, yeah. We don't have enough information to know whether Arami has a qualifying disability. In fact, our hypothetical didn't include any indication that Arami has a disability. Doesn't mean Arami doesn't, but we just don't know. So yeah, I hope that as we do more hypotheticals, like we're trying to build you up, I strongly encourage that after this intro training, you all try to find some time to practice this. Maybe go over past documentation of chronic homelessness that your agency has, because it is a lot of details at play. There's a lot to remember. Any other questions or notes about that hypo?
So let's just say that hypothetically, he did have a disability. So long as you have 4 breaks?
Yeah, so if we could establish a disabling condition, then what else would we need? Well, we have the current homeless status because Arami is currently sleeping in a tent on the sidewalk. What we don't have is the 12 months. We don't have them consecutively. We don't have them in 4 episodes. What we would be looking for is one sort of period of time in qualifying locations, and then a break, and then another period of time in qualifying locations, and then another break, and then another qualifying location period, and then another break, and then another episode. So you're going to have episode, break, episode, break, episode, break, episode. 4 episodes, 3 breaks. Is that helpful?
Yeah.
Yeah. Okay. All right. So now we're going to go through, I'm going to pass to Kyle to go over how do you document this?
All right, thank you, Eli. So now we're going to be talking about documentation of chronic homelessness and the various record-keeping requirements. Next slide, please. So whenever you're documenting chronic homeless status, there are a few things that it's really important to keep in mind here. So number one, the projects do have to maintain and follow consistent written intake procedures. Number two, those procedures must require documentation at the time of intake, including of disability, as Eli just described. And number three, the procedures must establish the order of priority for obtaining evidence. So what does that look like? Let's take a look at the next slide. So you see here that we have 3 different tiers of priority. So at the very top, we have third-party documentation. Generally that can be documentation that's been established by a different housing or services provider. But below that, we have second-party documentation. So that's going to include intake worker observations of the client's chronic homeless status. And then lastly, we're going to have self-certification. So this is certifications from the homeless individual himself. So whenever you're completing your documentation, we can move on to the next slide. Your documentation should include, number one, documentation of the client's current homeless status. Number two, documentation of the client's history of homelessness. And then finally, number three, documentation of the client's disability. Okay, next slide. So there are quite a few different forms, and we're going to get into them in greater detail, or at least most of them today. But these should all be available on the Santa Clara CoC website. So if you'd like to reference any of the forms that we're going to be discussing shortly yourself, please do feel free to go take a look at those forms on the CoC website. Okay, next slide. Okay, so kind of starting now, we're going to really dig into documentation of current homeless status for your clients. So for current homeless status and for any other part of chronic homeless documentation, it's really important to keep in mind that the order of priority is going to apply. So the options for third-party documentation are the first 2 things that we see in this list right here. So you have an HMIS record showing that the client lives in a shelter or on the streets or in a car or another place not meant for human habitation at the time of their entry into the program, or a written certification from another service provider. So this could be a referral from a shelter where the client is staying, or a referral from an outreach worker who may have had contact with the client directly and knows that they're living outside or in a car, etc. You can have written certification from those sources, and either the HMIS record or the housing or service provider referral can act as that third-party documentation. So for the HMIS record, you can just print out the record from HMIS and add it to your client profile in your documentation of eligibility, and that will satisfy your requirement. For the written certification, you probably want to use Form A. So Form A is a straightforward means of obtaining documentation. An emergency shelter should be able to fill it out for you. And as long as you have all the relevant information recorded and understand how the form works, then you will have sufficient documentation from a third-party source. So if you've made reasonable efforts to obtain either of those two forms of documentation and you just cannot obtain either of them, then you can document your attempts and fall back to second-party or first-party forms of documentation. So one version of a less preferred or last resort form of documentation is if you kind of use the person pulling the documentation together, the program staff who are verifying the documentation, if you go out with the individual and they can show you that they're living in a car, if you can observe where they are currently staying, or they can go out and show you where outdoors they're sleeping tonight. And you can physically observe the location where the client is staying. That is a form of documentation that you can use. However, it is a less preferred form of documentation. In that case, it is second-party documentation of the client's chronic homeless status. And similarly, there is self-certification, which is simply the client making a statement that they are currently staying at, for example, a cross street or in this particular park, and that is the location where they're living at this time. So for second-party documentation that's based on observation, you can use Form B, which is specifically designed to record staff observation. And for self-certification, you can use Form E. So please do take a note that both of those forms do have a backside. And the backside of the form is the place where you can record all the attempts that you've made to obtain third-party documentation. So it's all built in the form, you just have to go and fill it out. Also, just remember that recording your attempts to obtain third-party documentation is a part of the second or first-party documentation requirements. So if you're doing a less preferred form of documentation, you do need to be sure that you're documenting your attempts to obtain third-party documentation. One last note about chronic homeless status before we move on. So the intention here is to document where the client is staying at the point of enrollment into a program that requires chronic homeless eligibility. So to document living situation at the point of enrollment, the documentation can actually be dated anytime within 14 days prior to the client's enrollment. It does not necessarily need to be dated the night before enrollment, for example. So if you're in HMIS and you can find a shelter record from 3 days ago, that would be considered sufficient third-party documentation for a chronic homeless status. One of the things that you do want to keep your eye out for is in your client profile. One of the things we often see is dates of entry or dates of enrollment may be recorded differently in different places in the client file. So for example, one person is doing an assessment, one person may be doing the client's intake agreement, and it's possible that in some cases the dates may be recorded a little differently. And that can be a little challenging when you're trying to work backward from the date of enrollment to ensure that you're within that 14-day window. So the thing to remember here is to try to be very consistent with the details in your client file. I just want to pause for a moment and see if anyone has any questions so far.
Can I jump in really quick as people think about their questions? The 14-day window, as Kyle pointed out, is really important. And I really, Kyle, thank you for pointing out you need to know what your actual enrollment date is in order to know what is 14 days prior to your enrollment date. So having a consistent enrollment date is really important. That 14-day window for documenting current homelessness applies to third-party documentation. So an HMIS record, certification by another housing provider, someone who's not you, who's not the client, some third party out there, that can be within a 14-day window. if you're using your own as an intake worker doing the documentation, if you're going out and observing where the client lives, that second party physical observation, or if it's the client's self-certification, that does need to be literally the night before. It needs to be the night before that you're going to enroll them. That enrollment date needs to be what you're documenting. Okay, that's all. So, any questions?
Okay, thanks so much, Eli. I think if there are no questions, we could probably jump ahead to history of homelessness. Okay, so next slide. So the next step of the definition here is the client's history of homelessness. And this is kind of a long section because there are a lot of different options for documenting history of homelessness, so please just bear with us. Okay, next slide, please. Oh, actually, sorry, Nicole, we could go back to there we go. Yeah, so this slide here should give us a sense of some of that. These are all the options available for documenting history of homelessness. So, these are also just the third-party options. So as you can see, there are a lot more than just the two that were available for documenting the client's current homeless status. So these third-party options include getting an HMIS record or a written referral from a shelter or outreach provider, which you can use Form A to document. That's going to look the same as it does for current homeless status. But you also have a few other options for third-party documentation history of homelessness. We're going to get deeper into these in some future slides, but I do want to note that you can get an observation from any community member regarding where the household was living at any time in the past. And there's a form for that, and that's going to be Form B. You can get a certification by a housing or service provider in their professional capacity, which is a little bit different from a shelter referral. So this is going to be Form C. And you can also get physical observation. So for documenting current homeless status, documentation by program staff is going to be less preferred. That's always going to be considered second-party documentation. But in some situations, when you're documenting history of homelessness, the actual staff completing the intake, so the staff that's doing the documentation, you can use your own observations of past episodes of homelessness as third-party documentation. So we're going to go into this in greater detail a little bit later on, but just know that things are considered strong documentation for history of homelessness can be a little bit different from what is considered strong documentation for current homeless status. Next slide, please.
Kyle, there's a question in the chat, and I wonder if we can pause to address it. Where do I get the enrollment date? In HMIS, I only see a project start date. Should I?
Yeah, do you want to take a crack at that, Eli?
Yeah. So, in the slightly messy answer is there should be a policy and process within your program for how enrollment date is established and recorded. Typically, we see in a client file, there is an intake form and there is a date of intake or of enrollment. A client can be so enrollment means the client has been determined to be eligible, has agreed to participate in the program, and therefore can begin to, and you've decided to enroll them and you're going to begin to provide services. So there's not one place that you can go to find that date, but your program needs to have its own policy and process for defining, okay, when do we decide to enroll in a client? Where is that date recorded? I believe that a lot of times that does align with the project start date in HMIS, but I don't want to promise that that HMIS data entry is going to align with the enrollment date for your client. It usually should. That's right, Kyle. Project start date should align with enrollment date.
In general, it should, yeah.
Yeah, but it really does. It's all about what process your program has set up to make sure you have that enrollment date recorded. Do you have follow-up clarifying questions about that?
I was just going to add, I always thought it was like the project start date was the same as the enrollment date for the most part.
Yes, yes.
So yeah, so when you go into HMIS and then you go to the program, click on the program tab, it'll show you on the left-hand side, like what are the program names, and then next to that, it'll have a start date and then an end date, like when that person was exited from the program.
Yeah.
But
yeah, and that,
I guess it could vary, right? Like you said, it could depend on the program.
Yeah, that absolutely should be the case. For the most part, the project start date should align with the enrollment date. And I only point to, your policy, your agency policies and your program policies and process, because we do sometimes see that project start dates don't match intake forms and don't match assessment forms and all of that. So it's important that your program has a structure and a process in place to make sure all of those match. And in HMIS, it will be the project start date.
Right.
That should be the right date, yeah. And other folks who are more familiar with HMIS may be able to respond to the question about the active date. I'm not quite familiar with that.
Yeah, I confess I'm not too familiar with the active date term, but as Eli said, it's important to be consistent, and there can be variations by different types of projects too. Like an agency might define an enrollment date a little bit different for an RH program versus a PSH site-based program, for example. So just want to be sure that you're deferring to your agency's policies, but the important thing is to be consistent too when it comes to how we're defining when a client's actually entering the program. We also don't want to make this too complicated, so do feel free to lean into that project start date that you see available in HMIS. Were there any other questions so far? If not, then we can probably jump ahead to last resort documentation. Okay, so with this next slide, this really breaks down the less preferred forms of documentation on history of homelessness. So second party documentation, so this is program staff documentation, documentation done by the folks who are pulling together the documentation to establish the client's eligibility. So some forms of documentation by staff are going to be second party documentation. We're going to go into this distinction a little bit later on, but just note that sometimes if the documenting staff, so again, the staff who are certifying homelessness, sometimes that can be third party and sometimes it's not. Sometimes it is less preferred. And then of course, first party documentation, self-certification works very much the way it does for current homeless status. And we're going to get all this into more detail a little bit later on too. Okay, so next slide, please. Okay, so this slide here takes us into some other general rules about documenting history of homelessness. So third-party documentation is not just desirable because HUD prefers it. HUD actually does provide incentives to make third-party documentation work for you a little bit more efficiently than some of the other forms do. So if you have third-party documentation for just one night of homelessness in the past, then you can use that one night of homelessness to document an entire calendar month of homelessness. So for example, if you see that there's a record of a shelter stay for a client on September 10th of last year, so you can use that one shelter record as documentation for the entire month of September, which is convenient because it spares you from having to hunt down documentation for every day of the 12-month period that you're trying to establish. So there is an exception here. So if you do have evidence that there was a break in homelessness during that month, then you're not going to be able to ignore that and include the entire month as part of the client's history of homelessness. So if you do have evidence of the client spending at least 7 days in a non-qualifying location, then that rule, the 1 day equals 1 month of homelessness rule, is not going to work the same way, unfortunately. So in our example, where you have someone who had a shelter stay on September 10th, if you're looking in HMIS and you can see that they had a transitional housing enrollment that started on September 15th, so 5 days later, and that lasted for the rest of the month, for example. That would be a transitional housing stay that's 7 nights or longer. So yes, that would constitute a break in the client's homelessness. So then that 1 day in September can be used to document a homeless situation only up until that transitional housing stay. So for the first 15 days of the month. So you can add those 15 days into your 12 months that you're trying to calculate, but you do have to find some other ways to document a full 12-month period of homelessness. So that's an exception to keep in mind, but in general, 1 day is going to equal 1 month unless you have proof otherwise. Okay, next slide, please. Okay, so this next slide gets into some other ways that HUD deprioritizes second party and self-certification. So generally speaking, for chronic homeless clients you're documenting, you can document up to 3 months of their history of homelessness using second-party documentation by program staff or self-certification. So you still have to try to get third-party documentation, and you still have to document that you tried and you failed to get third-party documentation. But you can fall back to those less preferred forms of documentation for up to 3 months. But at least 9 months of the history of homelessness must be documented with third-party documentation. And at this point, it's not just a preference, it is a requirement that at least 9 months be documented by third-party documentation. So again, there is an exception here. HUD does give you a little bit of flexibility. So up to a quarter of the total households that you serve over an operating year can be documented with less preferred forms of documentation. So you can go up to a quarter of your clients in an operating year without any third-party documentation. It's also really important, if you think that's going to be the case, just to keep an eye on things that's going on at the program level. So every case where you do exceed that 3-month limit on less preferred forms of documentation, you really should be tracking that. It can be easy potentially to lose sight of that. If we're only looking at things on the level of individual clients, it can be easy to lose sight of what proportion of your clients are going to exceed this 3-month limit. And it's really important that we don't exceed that 25% limit. So really pushing to get third-party documentation on at least 9 months for most clients is really going to be the way to go. We do want to stress here that the 3-month cap on documenting history of homelessness with less preferred forms of documentation only applies to the episodes of homelessness themselves. So you're totally free to fully document all the breaks in homelessness with self-certification, provided that you can demonstrate that that was the only documentation for those breaks in homelessness that was available to you. There's no limit on the number of self-certifications you can do for breaks in homelessness. Okay, next slide, please. So this next slide focuses on those specific forms of documentation for history of homelessness and what they can look like. So we went over them pretty quickly earlier, the ones that are a little bit different from the forms used to document current homeless status. But we do want to talk about what it actually looks like when you do these. So for certifications of history of homelessness, the kinds of housing and service providers who can provide the certifications, it can be pretty broad. So you can obtain certification of history of homelessness from, for example, a healthcare professional who worked with your client, could be an educator, could be a law enforcement officer, if your client is comfortable having you reach out to them. Any person who interacted with your client in their official or professional capacity of providing services to the client. So this would not include something like a nurse who's just walking home from work and happened to strike up a conversation with your client, and that was purely a social conversation. But this could include a nurse who is providing medical care to your client or screening for your client, and had a conversation with them about their homeless status during the course of that professional interaction. Okay, next slide, please. So this slide here details some of the different ways that you can work with a housing or service provider to obtain third-party certification. So if the housing or service provider physically observes, saw with their own eyes, where the client was living at some point in the past, they can complete an observation of living conditions form, which is going to be Form B, if they're willing to do that for you. They would need to describe where they observed the client staying and how they could tell that the client was staying there. And of course, the living situation would need to be a place not meant for human habitation, or a shelter or other qualifying location. So if the professional did not observe the client's living situation, they did not go out to meet them where they were staying at the time, but they had a conversation with the client in their office or in another location, and through that interaction and based on the housing and service provider's professional judgment, they could deduce that the client was homelessness. If that's the case, then they can complete Form C. So if a nurse is speaking with the client in their office, they're not doing medical outreach in an encampment, they're in their clinic, and based on what the client is describing about where they're staying, difficulties with their current living situation, difficulties managing medications, for example, whatever the context of how that information comes up, as long as that professional can say, yes, I had a conversation with this client, and in my professional opinion, it is clear that the client was homeless at that time. So using either Form B or Form C, you do want to make sure that you're obtaining a clear statement from the provider of the time that they interacted with the client, of the approximate date. It's good to get the actual date if you can, but definitely have them at least identify that in the documentation that they're completing. So because it's third-party documentation, again, you can extrapolate from the date that they provided to the entire calendar month, again, unless we have evidence that there was a break in homelessness. But again, it's very important that we do have that approximate date identified in our documentation. So the next slide here details community member certifications. So this is documentation for history of homelessness, not current status. And you can talk to any member of the community who had knowledge of the client's living situation at some point in the past. So again, this can be any community member, but that community member needed to have physically observed, so again, with their own eyes, where the client was staying. So if the client tells you, I talked with a business owner at the strip mall near where I was staying every day, and we talked about how I was doing, or there was a neighbor who happened to pass by, and they could probably confirm the fact that I was living in this particular location and in this living situation. So any community member out there can do that. You can try to reach out to them and find them and get a statement from them. You can either have them write it down, which in some situations may be easiest, or you can speak with them over the phone, and then you can write down what they're saying to you to record that oral certification. You just have a responsibility to use your professional judgment and to decide whether or not that community member is going to be a reliable source. Okay, next slide, please. Yep. So this next slide here gives you a preview of Form B, so the observation of living conditions form that you would use with a community member. So this is the same form that you'd use for a housing or service provider if they're documenting the physical observation. You do want to ensure that you're identifying the location as precisely as possible of where the client was physically observed. So the form should include a brief description of the client's living conditions. It should also be clear whether they were observed sleeping in a car or in a tent or just out in the open, for example. You also need to demonstrate that the situation was physically observed again, and then you do have to have the approximate date. So for community members, you at least want the month to be identified. An approximate date is going to be best, but you definitely want them to identify the month where they did observe the client in that situation. Any questions so far about community member certifications or anything else we've discussed so far?
So I had a question about the different episodes. So I just really want to understand. So if there's so like you were saying earlier, the transitional housing, let's say earlier in that month, they were homeless, they were living in their car for the first 2 weeks. And then after that, they had transitional housing like the third week on HMIS the same month. So now you cannot count that whole month, doesn't count at all.
In most cases, that's going to be true. I think there is an exception for some specific types of transitional housing, which we'll get into in a little bit more detail later on. But yes, unless you have evidence of a break and that was longer than 7 days, then you can only count the portion of the month up until that break when you're counting the client's time of homelessness. Can you just confirm that that's the case, Eli?
Yeah, so we should add a visual slide to this because that would be really helpful. But if you have, right, you have third-party documentation of homelessness, say on July 7th, but then on July 15, you have a transitional housing enrollment and it goes longer than 7 days. You can document 14 days of homelessness, right? July 7th, that third-party documentation will cover July 1 to July 14. But then on July 15th, you have a transitional housing enrollment, and that starts a break in homelessness, right? And so you can't jump over that break for the rest of the month. But the third-party documentation does cover at least those 14 days. That makes it it's harder because then you have to cobble together another 16 days of homelessness in another month that's partial, because you are trying to add up to 12 months. So it gets a little more complicated, but you still can use those 14 days of July.
So for the partial month, does it matter how much time lapse in between? So like, let's say that was for the month of June, but then we didn't have another episode of homelessness, I don't know, let's say March, like there was a huge gap, like, is that okay?
It doesn't matter how long the breaks are. Yeah, so a huge gap is fine as long as you can find those 4 episodes within the space of 3 years. So a long break is not a problem in itself, but if the break is too long, then it can make it hard to find the 4 episodes within the time frame of 3 years. Does that make sense?
Right. And then each episode has to be 30 days, correct? So then since the 14 days would be a partial month, then you need to find, I guess, the other month would be find another 16 days, like you mentioned, in another month to make it 1 month for an episode.
It's a great question. An episode can be any length. So for example, you can have someone where you can document that they stayed in an emergency shelter for 1 night, and then they had a month of break, and then they stayed in an emergency shelter for 1 night. So that's 2 episodes. They had a month of break, and then they still in an emergency shelter for 1 night, and then they had a month of break. So that's 3 episodes, right, of 1 night each. And then they were homeless for another, I guess it would be almost 12 months. So it's not a great example, but the point being, it doesn't matter how long the episodes are, as long as there are 4 of them and they in entirety add up to 12 months.
So then that one that you were mentioning earlier, the 14 days, that could count as 1 episode.
1 full episode. Yep.
Okay.
but you just need to have other episodes that can add up to 12 months total.
12 months. All right, thank you for clarifying.
Yeah, thanks for asking the questions. And I'm sure that was helpful to other folks as well. So ask those clarifying questions. Great.
Absolutely. We've had some good questions so far. Any other questions, by the way?
What is HUD's justification for guidelines of 4 episodes of homelessness and 3 breaks? It's such a great question, Amanda. I think generally speaking, what HUD would say, just broadly, is they were establishing a rule that they want that would capture the highest acuity folks, people who had been experiencing, persistent long-term homelessness. Why 4 episodes with 3 breaks exactly? If you're interested in hearing HUD's justification, I would point you to, there's a lot of comment on the interim rule. And so comment on an interim rule is just people sent in questions or raised issues with the rule, and then HUD responds. So all of their justification is really well written out. I'm not going to mount a defense or an apology for that, but it's really well documented. And the what is it? The dedicated plus, that expanded modified definition that dedicated plus projects can serve, is in part a response to, it's really hard to document this rigid 4 episodes with 3 breaks. So, and Amanda, if you want to shoot us an email, I can send you the interim rule with comment.
Cool, thank you. I appreciate that.
Got a lot of forms to get through.
Really quick, I just want to ask, we only need one of those forms, right? You mentioned, you went over form A, B, and C for the documentation. You'd only need one of those. Yeah, yeah, that one. So B, C, and A, you'd only need one of those forms for the documentation.
Yep, exactly. Yep.
Okay.
Okay. So this next slide here does break down kind of things by program staff. So this is the staff, the workers of the program that the client is attempting to enroll in. So the staff who are actually completing the documentation. So for history of homelessness, sometimes this can be third-party documentation. Sometimes it can be second-party documentation. I'm just going to skip ahead to the next slide, which breaks all this down pretty clearly. So if you're completing documentation and you're describing a client's situation that you observed at some point in the past, could be a month ago, could be a year ago, you were speaking with the client in the location where they're living, in a place not meant for human habitation, or in a shelter, or another qualifying location. So you can actually complete the observation living conditions form for that past interaction. So that's going to be form B, the same form that we were looking at. If sometime in the past you had a conversation with the client, just like any other housing or service provider, then you can use form C to certify their homelessness based on your professional judgment regarding some encounter that you had with the client in the past. So maybe the client visited a drop-in center a couple months ago, and you had a conversation with them, and it was clear to you from that conversation that the client was, in fact, living outside or living in a shelter. So you can complete that certification based on professional judgment. So again, form C, and that counts as third-party documentation. So regarding second-party documentation, the conversation at the time of intake, the conversation that happens at the point where you're trying to establish this documentation. So let's say that's the only interaction you've had with the client. They're describing their living situation, let's say 3 months ago at the time that they're enrolling in the program. And you can tell based on what they're describing to you that they're homeless at that time. You can certify that using your professional judgment. So in that case, you'd use Form F to do that. But that is second-party documentation, so that's less preferred. You do need to try to get better documentation first, and then in some situations for up to 3 months of homelessness. So again, you can fall back to the less preferred form. Okay, so this next slide describes the final form of documentation, which is going to be first-party self-certification. So we're not going to go into this in a ton of detail. We've detailed this kind of when we went over discussing current homeless status. But it's just the client completing Form E to certify their own homelessness. And you also are completing Form E to show that you could not obtain more preferred forms of documentation. Okay, so next couple slides. So the next 2 slides show that self-certification form. This slide shows the first slide, or the first side of the form. And next slide. So the next slide should show the second slide of the form, which is the staff supplement portion. And you do just want to make sure that you are completing the entire form. Okay, so documenting stays in institutions. So unfortunately, many of the clients that we often serve do tend to be in and out of treatment centers, hospitals, jails, or prisons. So those are all going to be institutional situations. So documenting stays in institutions is going to be a very important part of telling the story of the client's full history of homelessness. So if a client's stay in an institutional facility was fewer than 90 days, then those 90 days may be included in the total 12 months of the client's history of homelessness, as long as you have evidence that you can document that a client was in a place not meant for human habitation or shelter or one of those other qualifying living situations immediately before they enrolled in the care facility or institution. So you can use any of the 4 types of third-party documentation that we discussed earlier to document homeless status immediately before the institutional stay began, and then evidence showing the length of the institutional stay, because you're trying to document that the institutional stay was fewer than 90 days. So it is really important to get the length of that stay documented. Okay, next slide. So you know that the client was homeless before entering the institution. So ideally, you would obtain discharge paperwork, but it must clearly identify the start and end dates of the institutional stay, so you can demonstrate that the stay lasted fewer than 90 days. Or you can obtain a written or oral referral or statement from someone who works at that institution who had knowledge of that stay. So again, the stay it should clearly show the start and end dates of the stay, because again, we're trying to document with third-party documentation that the stay was fewer than 90 days, so that we can include that stay in the client's history of homelessness. So when you cannot obtain either of those third-party forms of documentation, either of those preferred forms of documentation, you do at least have to show that you tried. So you do need to have a written record of your attempts to obtain that documentation, and you can fall back to having the client self-certify, which should include at least the start and end dates of their stay in the institution if preferred forms of documentation are unavailable to you. One final note about institutional stays before we move on. You're trying to document an institutional stay of fewer than 90 days if you are trying to include the stay in the client's history of homelessness itself. So an institutional stay of longer than 90 days is going to represent a break in homelessness for the client. Okay, next slide, please. So this slide shows a different type of break in homelessness, which is going to be a stay in transitional housing that is 7 nights or more. So that would be considered a break in homelessness. So one exception that we alluded to earlier is if a veteran has been assessed in the VA system and the VA system has documented their chronic homelessness at the time of intake into a VA-funded transitional housing facility or an intake into the VA system in general. So if the client stays in, for example, a GPD transitional housing program for more than 7 nights, then the client actually does retain their chronic homeless status. But for any other type of transitional housing program, any stay of 7 nights or more is considered a break in homelessness. And also breaks in homelessness aren't necessarily a bad thing. Sometimes you're trying to use those breaks to document the client's 4 episodes of homelessness. Okay, and speaking of documenting breaks, let's talk about that a little bit more. So documenting a break in homelessness can be done through an HMIS record to show enrollment in a project if the client was enrolled in a rapid rehousing program or a permanent supportive housing program for a certain period of time. You can get a written referral from a housing or service provider that certifies to that fact as well. You can obtain a written observation from an outreach worker, maybe an outreach worker who's working with the client while the client was paying for a hotel room, or while the client had moved in with a friend for a while, and the outreach worker was still in contact with the client. But if you cannot obtain any of those third-party forms of documentation, you can always fall back to self-certification. But again, as long as you document your attempts to obtain more preferred forms of documentation. So just remember there's no cap on the number of self-certifications you can do when documenting breaks in homelessness, again, provided that we did attempt to get more preferred forms of documentation. Okay, so we're gonna pause for a quick quiz on the material that we discussed so far. I know this has been quite a lot. So this slide here outlines a little scenario for you. So to help document a new client's length of time homeless, you obtained a written statement from someone in your agency's outreach team. So the statement says that the outreach specialist spoke with the client on July 23rd and observed the client's sleeping bag and personal items just off the path near Guadalupe Creek. So here's the question. What type of documentation do you think this is? Yep, perfect. So we have second-party documentation, third-party documentation, self-certification, or none of the above. So remember, you are documenting the client's length of time homelessness or history of homelessness, and an outreach worker on your agency's outreach team observed that where the client was sleeping. So does this sound like second party, third party, self-certification, or none of the above? And we'll take just another moment or two for you to enter your answers in.
I love the mix of answers we're getting for this.
Hey, fantastic. Mix is always good. Yeah, and it doesn't have to be perfect. Again, this is kind of a whirlwind presentation. The goal here is just to get you thinking about how this all works and functions in practice. Okay, just a couple more seconds. Okay, we can probably go ahead and close our poll. Ooh, very interesting. So it looks like a tie between second party and third party. Some folks responded with none of the above. So in this case, the documentation would be third-party documentation, and for a couple of reasons. So number one, if your agency has an outreach team that is separate from your agency's housing programs, let's say your agency has a permanent supportive housing program but they also have a separate outreach team that is distinct from your PSH program and it's not funded by your PSH program, then that outreach team will always be able to complete third-party documentation, just like any other outreach team. So when we talk about second-party documentation, that is the staff and the team at the PSH program that is doing the documentation right now for the client for this program. So as a general rule, when you do have a scenario like that, it's always helpful to reach out to home base to confirm whether documentation is third-party documentation, but most of the time it will be third-party documentation. Another final thing just to keep in mind here as we're talking about history of homelessness is that for history of homelessness, even if the outreach team themselves were responsible for pulling together this documentation, so they really are the program staff doing the documentation, even in that situation, because they're documenting situations that occurred in the past in terms of the client's history of homelessness, and they observe the client or the client's sleeping bag, for example, in the past, as part of documenting something that happened previously, that will work as third-party documentation for the history of homelessness, even if it's the program staff themselves who are completing the documentation. Okay, well, thank you so much for participating in that little exercise. I hope it was helpful. And now I'm going to pass things over to one of my colleagues who is going to review documentation of disabilities.
Yeah, thanks, Kyle. And we're going to wrap up with documentation of disability. And then I'm going to say a few more words about the fact that this is a lot of information and it's a survey. And I'm going to point you to some ways to really help this sink in, practice, and confirm that you understand. So, disability. It's one of our 3 pieces of chronic homelessness. We've talked about documenting current homelessness. We've talked about documenting history of homelessness. And now we're going to talk about documenting a disability. There are a number of different ways that HUD will, a number of different types of documentation that HUD will accept. Written verification from a professional licensed by the state to diagnose or treat that disability. That's a very common one, and I have a whole nother slide that's going to dig into what that means. Other types of acceptable documentation are written verification from Social Security, receipt of a federal disability check, so just getting SSDI or veteran disability, HUD accepts that as documentation of a qualifying disability. You can also use, if you can't find one of those third-party documentation, you can intake staff recorded observation of disability, right? So if a client's coming in and you can see this client definitely has a chronic disabling condition that's going to interfere with their ability to live independently or to maintain permanent housing, you can document that with your own staff recorded observation. But you always do have to get another form of documentation. You have to get that licensed medical professional or federal disability check or verification from SSA within 45 days. So for a little bit, if you can't get that right away, you can still enroll the client as long as you can do your staff observation and you're pretty confident you can get that confirmation within 45 days after enrollment. And then there's this category of other documentation approved by HUD. That's pretty vague, pretty broad. Typically, we stick with the written verification from a professional, SSA, or disability check. If you have questions about other documentation, we're always happy to take that over email. Go ahead, Amanda.
I was just going to ask, I don't know that I've seen the intake staff recorded observation of disability. Is there some sort of form that can be used for that, or is that just, you know, like a written statement, or can it be found on intake forms usually?
It would be a written statement, and there is a form. I know the form that I know about that the CoC has is related. It's related to one of our recent COVID waivers. So I'll make sure that as an example of what written staff observation could look like gets included in our follow-up. Off the top of my head, I'm not remembering if there's another specific form, but we'll definitely address that in our follow-up email.
Thank you. I appreciate that.
And I just want to, as a last bit of content here, I want to zero in on this written verification from a licensed professional, because our other options here, specifically the federal disability check, that's super easy. If you have that, that's just it. That checks the box. But if you're looking to document this with certification by a medical professional, it's important what they're diagnosing, right? What they're certifying to. The certification doesn't have to have the specific condition that's being diagnosed, but the certification needs to very clearly meet one of these three options, either HIV/AIDS, a developmental disability, or a disabling condition. And it's clearly stated that that disabling condition is both expected to be long continued and substantially impedes the individual's ability to live independently. Has to be like, that can be there's a certification form that the CoC does have that includes both of those things, and the professional can just check boxes and sign. If you're getting an email from them, you have to make sure that the text of that email or letter includes clearly aligned with the HUD definition. Then the last thing I want to note is this licensed by the state to diagnose or treat the disability. Homebase has some clarifying guidance and sort of information about that. It's a question that often comes up, and the best thing that I can tell you in this overview training is, if you're wondering whether a medical professional is licensed to diagnose or treat a disability, send us an email and we can help you walk through that. So it's a gray area question that we can't fully explore in a training like this. So I want to thank you all for your time today. We know that this is a lot, and we don't expect that after an hour and a half of chronic homelessness training presentation, you're going to be able to go and do this perfectly right away. But what we encourage is, as you have questions and as you're documenting disability or chronic homelessness, or reviewing documentation that's being given to you, you can come back to the recording of this training. You can come back to these slides. You can come back to those forms on the CoC website, and I would really encourage you to get familiar with those. They often will walk you through really step by step a lot of this process and information. And you can email us, Santa Clara CoC at homebaseccc.org. We will also send an email from us with follow-up, some of the follow-up materials to folks who attended this training. But we are here as a resource specifically for you, all of you as individuals. So don't hesitate to email us, even with very specific questions. You have a particular client and you're not sure if the eligibility documentation is good. Don't give us identifying details about that client. Don't break confidentiality, but give us the general situation, and we are happy to respond to those types of questions. So thank you all again. We really appreciate your attention and your time. Nicole has put into the chat a link to a feedback form. It's a quick survey, and your feedback on these trainings really, really helps us. Let us know, was it too fast? Was it too slow? Do you want more practice? Should it be longer? Should it be shorter? Should the chronic homeless definition be different? No, don't tell us if you think that. We can't do anything about that. But any other feedback, we love to hear in the feedback survey. So the link is in the chat, and we hope that you all have a great rest of your day.